Hi, my name is Samara Wolpe. I'm a PhD student from UCLA. I have dark hair, and I'm a white woman wearing a green shirt with a UCLA health background. Today, I'm going to present my study, Promoting Success in College, a scoping review of autistic students' post-secondary education experiences. In recent years, there's been an increase in autistic adults enrolling in college, but still the national graduation rate for autistic college students is only 41% compared to the national rate of 62.3%, meaning that many autistic college students are enrolling in college and yet are not able to graduate. While there may be many reasons for this, there has not been much research examining why this might be the case or what barriers autistic college students are experiencing. And part of the reason for this is that there is, in general, a lack of community partner research examining autistic adulthood, specifically the perspectives of autistic adults. Therefore, I conducted a scoping review of literature examining autistic college students' characteristics, experiences, service receipt in a college setting. To analyze the results and understand their experiences, I used the social model of disability and neurodiversity as frameworks to help understand and contextualize participants' experiences. I conducted an electronic data search through PsycInfo, PubMed, Google Scholar, and Web of Science using the following keywords: autism or Asperger, autism spectrum disorder or disorders, and college or post-secondary education. Articles were included if they were from the autistic individual's perspectives, were published in the US, were written in English, and contained multiple participants. They were excluded if they were published prior to 2013, not published in the US, were case studies, review articles, or experimental designs, testing, and intervention. Here's a flow chart, a Prisma chart of how studies were identified and included, and which articles were removed. Literature trails were conducted to ensure that no articles fitting this criteria were missed. These articles yielded 5 major themes across studies examining autistic college students' post-secondary experiences. The first major theme was social environment and supports. So the majority of participants across these studies reported no close friends or very few close friends. And to many, finding friends and groups was not a priority in college. Many relied on already existing friends from high school or elementary school or family to support them through college socially. The next commonly identified theme was available services and service gaps. The most frequently used accommodations were increased test time, note takers, distraction-free test areas, flexible due dates, and permissive technology use in that order. One quote that particularly struck me as exemplary of this, as a good exemplar of this theme is, accommodations are good if the professor complies. Sometimes the professor does not comply and there is nothing that can be done. This was unfortunately a commonly discussed theme that professors or faculty did not always honor accommodations. Several other themes that were identified: mental and physical health. Autistic college students reported significantly worse mental and physical health compared to non-autistic college students, and were more than twice as likely to report having a co-occurring disability or mental health disorder. Additionally, certain individual characteristics shaped strategies for success amongst college students. For instance, most autistic students surveyed or interviewed felt that they had the ability to succeed in college, but they struggled to manage their time and focus and paying attention during lectures, saying, "It's not designed for us." This indicates that executive functioning difficulties and the way that college and lectures are structured may not be ideal for many autistic college students to navigate. Additionally, participants were more likely to attend a 2-year rather than a 4-year college, indicating that a 4-year college may not be the most accessible or easily streamlined route to higher education. And lastly, the final theme that was identified was identity and disclosure. Attitudes towards disclosure of an autistic identity were split. Some participants felt confident disclosing, while others feared stigma. In particular, while this was not frequently brought up, and the research in this area is somewhat sparse, intersectionality played a role, with Black students expressing feeling afraid, a Black student in particular expressing feeling afraid that she would experience additional additive discrimination, which is something that perhaps future research should examine more specifically. So from these results, we understand that there are many factors that may pose significant barriers to autistic college students, and that autistic college students are able to, communicate them and understand where these barriers take place and propose solutions that could be workable. For instance, under helping professors to understand how to work with their accommodations. And future research may partner with autistic advocates and stakeholders to create resources for autistic adults in college. Understanding the potential barriers to autistic individuals achieving success in higher education is crucial to promoting successful careers and better quality of life in the autistic community. Thank you.